We,
Sohnia
and Jaanuni, are a couple of pals studying science in undergrad. We are not professionals.
Though every episode is meticulously researched, mistakes do happen.
If you notice that anything,
And we mean anything,
we state is inaccurate, please let us know.
Your comments, suggestions, and queries are important in furthering our personal and audience's understanding of science.
Thanks for being a part of this discussion.
We appreciate you.
We really do.
Bop bop, beep bop bop.
Welcome back to another episode of Beaker Bros.
Oh shoot,
Where we drink out of beakers.
because we're bros. Clink with the beaker, dink. Yep.
Dink. But yeah, as Sonia was saying, on this week's episode, we got a special guest.
Mm-hmm.
It's not just Jaanuni and Sonia. No.
It's Leanne Goodman. Well, anyways, we're gonna jump right to this podcast because I think Leanne has a lot of awesome insight to share. Doo-doo.
You enjoy it.
Ba-dum-bum.
This meeting is being recorded. Leave meeting. Just kidding.
Just leave? Okay, that's it. Alrighty.
Hello.
Hello. I'm going to read the introduction of our guest over here. So, Leanne Goodman is entering her 4th year of Honors Life Sciences with a specialization in sensory motor systems. If her program title is any indication that she loves learning about the brain, she's also completing her undergraduate thesis at the Max Stroke Lab, where she'll have the opportunity to further explore her interests in cerebrovascular health and human anatomy. In addition to being a heckin' smart person and a hoot to be around, Leanne is also heavily involved with volunteering in the Hamilton and McMaster science community, is a former competitive gymnast, and is a great crocheting person. I'm not sure if there's like an actual title to a crocheter.
Crocheter.
That's
I'm
it.
not sure, but
Person of
thank you for
crochet.
the very, very wonderful introduction. I'm excited to be here. Thank you for having me.
No problem, ladies and gentlemen, Leanne. So, Jaanuni, I was wondering if you want to like discuss before we go into interviewing our guest over here, if you want to talk about like why we're dedicating this episode to stroke awareness.
Well, this month, as you may know, in Canada specifically, it is Stroke Awareness Month. So that's kind of why we're doing this whole episode about stroke and why we have Leanne on this week's episode too.
Mm-hmm. And just to add like a little bit more of a statistic side, here in Canada, it's the leading cause of adult disability and 3rd leading cause of death. But also, if we want to look at it again on a more local level, currently more than 700,000 Canadians aged 20 and older have experienced a stroke. I guess, we're talking about all these numbers. Leanne, I was wondering if you can define a little bit what a stroke is.
Sure. I just want to preface that I'm absolutely not an expert on this, but my research placement has obviously, taught me a little bit. So from my knowledge, in simple terms, a stroke basically occurs when blood flow to certain parts of the brain gets interrupted or is reduced. And so without enough blood flow, the cells in your brain, they can't get the nutrients and the oxygen you need because blood carries that stuff to the cells. And then without those, your cells won't be able to survive. And within minutes of reduced blood flow, your cells start to die off. And so reduced blood flow can actually happen to any part of the body, but it's particularly detrimental to your brain cells. Those are also called neurons because these cells are the ones that transmit electrical signals to your body. They tell your muscles what to do, your heart what to do, basically everything. They tell your entire body what to do. And they actually don't have the same capacity to regenerate like other cells in your body, like skin cells, for example. So when they die off, it's really detrimental.
Mm-hmm.
We didn't talk about how what the different types of stroke are and how they happen.
If you
I don't know if you want to talk about that.
Yeah, if you want to go for it now, go for it, definitely.
Okay, so there's 2 main causes of stroke. One occurs when you have a blocked or narrow artery, and so that can be from anything ranging from a blood clot that blocks an artery or by fatty deposits that sort of get lodged in your artery and that blocks blood flow. And another one is a leaked blood vessel or ruptured blood vessel, and that can also stop blood from reaching your brain. And so the blocked artery is called an ischemic stroke, and a leaked or burst vessel is called a hemorrhagic stroke. And then also, like I said before, there's something called a transient ischemic attack or a mini stroke, but this one doesn't cause permanent damage, but the symptoms are the same, so you'll never know whether you're having a transient ischemic attack or a stroke.
Nice.
Okay. So from your definition that you just gave there, which was awesome, by the way, I thought that was really like explicit and to the point. It sounds like there's a cascade of events that sort of go on that, ultimately lead to a stroke. But I guess before those events even occur, are there certain precursors or certain things that you can do in just daily life that could prevent stroke?
So before we get to that, because you asked me about like the symptoms to it, there's actually, if you take anything away from this podcast, you should take this away from it. There's an acronym that helps you remember like the symptoms. So it's FAST. So F for facial drooping, A for arm weakness, S for speech difficulty, and then T for time, which means, time to call EMS because person is most likely having a stroke. So if you remember those 4 letters, you can basically help anyone who you might think is having a stroke. So those are sort of like the events that might lead up to it. But in terms of like precursors and what can be done, one of the best things that you can do, and this is something that I did in my research, is exercise. Exercise not only reduces your risk of stroke, but also other comorbid diseases, so other cardiovascular diseases, and it also just leads you to living a healthier life. Another thing you can do is eating a balanced diet, seeking treatment for any underlying conditions. So we'll probably touch on those later to what is sort of, the populations that are most at risk, so underlying conditions.
Yeah.
As a follow-up question, I was just going to ask, like when you mention exercise, is there a specific kind of exercise, or is it just like exercise in general, like working out or whatever?
Yeah, so my project specifically focused on looking at different types of intensity. And so I was sort of investigating whether like moderate intensity and high intensity or low intensity would be the best. But I only really focused on one specific aspect, which is like blood flow to the brain. So I didn't really look at a broad sort of look at it. I just looked at it specifically. But as of right now, recommendations are moderate intensity exercise. There hasn't really been enough research on high intensity and the safety on that.
Interesting.
Mm-hmm.
One thing that you brought up is certain, how do we explain it here? Certain factors that lead to stroke.
Factors.
Yeah, certain risk factors that lead to stroke that are more prevalent in certain populations.
Mm-hmm.
So I was wondering if you could like shed some light on that. Like,
yeah.
What do these look like?
Absolutely. So the first one, obviously pretty self-explanatory, is physical inactivity. So physical inactivity is probably one of the higher risk factors for stroke. So obviously being active and getting some exercise will help you prevent that. So physical activity is one of them. Additionally, being overweight or obese also will increase your risk of stroke. Heavy or binge drinking and use of other drugs and stuff like that, and some other not so controllable factors. Well, I mean, they are controllable, but they're more like clinical factors. So high blood pressure and high cholesterol, diabetes. And so that's what I meant when I said seeking treatment for underlying conditions. So by seeking treatment for high blood pressure, for example, you can reduce your risk of getting stroke.
If I could just add something to that. I know that one way that you can identify risk factors is either like modifiable risk factors or non-modifiable ones. Mm-hmm. So modifiable ones are like what you were saying. So like obesity, lack of exercise, but then there's also ones that are non-modifiable.
So yeah, I was going to get to that. So some of the ones that are kind of harder to modify is family history of stroke or heart attack or transient ischemic attack, which is like, they call it a mini stroke. Mm-hmm. And yeah, again, age, people 55 or older have a higher risk. Your race, actually, African Americans have a higher risk of stroke. Mm-hmm. Men have a higher risk of stroke. And then also just any cardiovascular diseases, underlying diseases that you have.
Yeah, just to add on to that again, in our one of our previous episodes, we talked about health disparities. So certain populations, simply because of the color of your skin and where you were born, is an indicator of, future health outcomes. And one of those things that a lot of the studies talked about was like incidences of stroke. Like certain populations, if you come from a low income background, you're likely to have higher incidences of stroke in that population compared to others. So
and that also relates to what I was talking about with the diet factor as well. Lower SES also have poorer diet.
One thing I wanted to ask, sorry, Janine, were you going to say something?
No, it's fine. I was trying to breathe.
Okay, fair enough. Breathing's important.
I was gonna say, like you mentioned, okay, correct me if I'm wrong, but you mentioned that men are more susceptible to stroke. Was that what you said? Okay, because I was like looking up something and it was saying that how like women are under researched and underdiagnosed when it comes to strokes, but they tend to have higher mortality rates and more severe outcomes in comparison, like following a stroke in comparison to men.
So what I have here is that men have a higher risk of stroke. And women are usually older when they have strokes. So they're more likely to die of them because of the age factor.
Okay.
Yeah, that's just what it says here.
The more we know.
That's interesting. I wonder, I'm not sure if you can comment on this as well, but how do I word this question? So when a woman experiences a stroke versus a man, I guess, are there different symptoms that are experienced, or is it something that's sort of like universal?
That's interesting that you bring that up because stroke is actually one of those diseases that's so variable. So when I did my volunteering in the stroke rehab ward, like the presentation is so different between people. It's crazy because you see some people come in and they have full function of their arm, but they just need help walking. And then there's some people who like couldn't even speak because their facial muscles and like whatever, it all depends on the area of the brain that is affected, right? So like if your speech area in the brain is affected, obviously you're gonna have trouble producing speech. And so there was a whole wide range. So I would see people, so I volunteered and I just sort of assisted the physiotherapist. I didn't really do a whole lot, but I just got to sort of experience like the process of them recovering. And a lot of people you could see, it also depended on their age. So a lot of the older patients wouldn't have like as fast of a recovery with their walking. It'd take them longer. So I'd see them like for 3 weeks and I'd see that they were progressing very slowly. Whereas other patients you'd see within 2 weeks, they'd be already on their little roller walker instead of on the bars. Yeah, it was really interesting to see.
Did this volunteering like help you, like I guess, gain an interest into studying stroke and stuff, like into your research?
It definitely did in a way. Like, I mean, sorry, oh, my mic. I probably like I don't know if I would have even found this volunteer or this lab experience had I not like already had a previous interest in stroke. You know, like definitely led me in the right direction. But yeah.
Interesting. And especially, I guess, like with the pandemic, your research experience must be very different than what you expected.
Yeah, my experience was not that of a traditional research experience. I started with the lab in January and we were still fully virtual. So, you know, I haven't actually been in person and seeing participants and stuff like that. So, but it's still been a positive experience. Like it's been very enjoyable so far. And I've learned a lot. I'll talk about that in a bit if you want.
We can talk about it now.
Yeah.
Okay. So I can definitely say that doing research has taught me like a practicum placement has taught me like a million times more than what sitting in a classroom would have taught me. Like in second year, we had to do a research methods course. And I can confidently say that I have learned like 100 times more just through this like few couple months actually doing a research placement. And it's just nice because you actually go through the process and you're learning all these tips and tricks from like the grad students of like what to do, what not to do. And, you know, rather than just getting taught the information, you actually get to go and like ask a question and then find the answer to the question, which is so much more interesting than just being fed the information. And you just learn so much more that way.
I was just going to say that like maybe this research thing is like, because of like the amazing experience you guys had, that's kind of why you guys still want to do a thesis and everything, right? Because both of you guys are at the same lab, right?
Can't get rid of each other.
No.
Wait, do you guys even know if the thesis will have some in-person component?
No idea yet. We're hoping.
Fingers
Yeah.
crossed.
I mean, for me, I'm almost entirely certain that it's going to be virtual, because I don't think really any component of mine has to be done in person, but I don't know, maybe that's just me.
I have no idea. I haven't figured out my project yet.
No comment.
Yeah, exactly.
I guess another question I wanted to ask is that, has this opportunity, considering how much you've learned from this experience, do you think it's informed your future career path? I guess that might be a lot to consider, but
I mean, I guess so. Yeah, like I like working with clinical populations, so I knew that, a lab in like a cell bio or microbiome lab was not my thing. And yeah, working with people is definitely an interest to me. So through this thesis, I'm hoping to sort of figure out what I want to do later. Maybe I'll come back as a grad student. Who knows?
Ooh, that's interesting. Wait, can I actually ask though, are you considering applying for like a rehab science program?
Yeah, I'm gonna apply for a master's. We're gonna see what happens.
Okay, very nice. That's something to look forward to.
Mhm.
So stay tuned for next year to see if where Leanne goes.
Yeah.
Yeah, stay tuned.
I guess another question I wanted to ask you is that Jaanuni is smiling for some unnecessary reason. But anyways, I guess another question I wanted to ask you, have you had any challenges trying to communicate what you've learned to your family or to your peers who aren't necessarily in science? And how have you navigated that?
So I'm just going to go with this on a general sort of term because I haven't really needed to explain my specific research because there hasn't been a whole lot yet. But I think the biggest challenge is trying to debunk misinformation that people see online. And like a lot of people who may not have had post-secondary education experience or like have learned how to tell what fake news is, they're just not up to date on it, and they're just really bad at catching fake news, to put it nicely. And the old saying of don't believe everything you read on the internet, yeah, that's gone out the window. People don't understand that anymore, and I think people have forgotten that. And that's the biggest challenge, is when people see something on the internet, trying to explain to them and trying to lead them in the right direction of like, hey, this is not a reliable source. I think you need to make sure that you're reading stuff that has actually been proven. So, I mean, I can give an example, but I don't really want to get into it. But through my undergraduate experience, a lot of my courses have actually focused in at least a little bit in reading and understanding scientific information and research and trying to translate that to non-experts or lay audiences. And I think that's given me skills that I need to inform like my friends and family a little bit better. So for example, we actually took an entire course. I think all three of us were in it, maybe. And it was
3PO3? Yeah,
3PO3.
Yeah.
Yep. All three of us took this course. And so it was basically an entire course. You guys probably talk about it too, where we just learned how to communicate science to non-experts and how to approach like wording and making it simple enough to talk to a 5-year-old versus a teenager. And yeah, that course definitely gave me a lot of skills in trying to approach, because I think one of the statistics was like, I don't remember the exact number, 44% of people are skeptical of science or something like that. It's like a crazy number.
Yeah. I mean, you could say that like on the bright side, hey, like 56% are like understanding
Not
of
skeptical,
it,
yeah.
But then still, that's still so bad. You have
Yeah.
to acknowledge that 44% or whatever that number is, because that's the population that's misinformed. You gotta help orient them to understanding what things actually mean.
It's such an important skill though to like communicate science to like, not like, I'm not trying to say even to the general public or like those who not are educated, but like there are people I've met who have such like post-secondary like education, but still like believe things that are like just misinformation that like sounds quite absurd. Like if someone were to present this information to us, would be like, what? But then it kind of takes, like for me at least, I have to step back and be like, okay, these people really don't know what's going on. And then I feel like as like, I guess we can be considered science communicators, like with your research position and whatever. It's kind of, we have like a sense of responsibility to be like, hey now, this is
Whoa.
no, this is what's actually happening.
Yeah, that's like, so even so near the beginning of this pandemic, when the whole like vaccine started becoming a thing,
Mhm.
the whole idea of, oh, the mRNA vaccine can alter your DNA, which is just like absolutely doesn't make sense to us students who are in a STEM program, but seems realistic to other people. You have to, figure out how to approach it so that you're not also not attacking people, but you're also informing them and making sure that they're not skeptical of what you're saying because you're more educated on the topic.
No, definitely. Like even with the vaccines right now, I know like I met a person who was like, I'm gonna wait for everyone to get their vaccines until I get mine, just because she heard that you can get COVID from a vaccinated person. I'm sorry, I'm giggling just because it sounds really like absurd to me, but also at the fact I have to like think and be like, okay, this person really like was really believing these like the news and all these theories, and to her it's very valid. But sorry, I was just like, okay, there's like a lot of misinformation. It was just very shocking, just because like I feel like I surround myself with people that are somewhat aware of misinformation and like what science is, but you kind of step out of there a bit and you're like, oh, okay, so this is very, very real. Like that 45% is quite like, okay, it's kind of scary.
Yeah.
If I could just add to that. So have you seen on TikTok, this is so bad. So there was a woman who posted
the magnet. Yeah, my
yeah,
brother
the
tried
magnet
it.
thing. Yeah, and so many people. So just to explain what the magnet thing is for people who don't know, basically, there's these really false rumors that have no credibility to them, where there's people think that there's like a microchip or something like that inside the vaccine. So if you get injected with a vaccine, like if you put a magnet to your arm, it'll stick. No, there's no microchip in the vaccine. The reason why it's sticking to your arm is because like if you put a magnet there and the magnet isn't that heavy, like obviously if you have sweat or something on your arm, it'll just like stick naturally. It's not because there's any magnet in there. But anyways, people believed it. Like they saw the magnet sticking to her arm. People, oh
my God.
Caused so much of a ruckus, and then people had to go on and say, no, this is false. The girl even made a TikTok saying, I'm sorry I did that. I didn't realize I would misinform so many people. But yeah, it literally got millions of views, and it scared the poop out of people.
Can imagine. Oh my God. I guess like, okay, we're talking about vaccines, but back to the stroke. But like, what's the biggest like misinformation thing like you guys have heard about stroke being spread around?
I don't know if I've heard of misinformation necessarily, but I think people don't not that they don't understand, but people don't necessarily know that like if you get treatment faster, then you have a better chance of like not only surviving, but like just a better chance of
like
recovering. Yeah. Okay. So if you see these symptoms, I think there's a very slim window where if you get treatment, like, yeah, go ahead.
No, I was just gonna say no. Like it was a 3-hour gap. So if you get it within like 3 hours, then you're more likely to have better health outcomes.
Yeah, so I think people just need to know that like if you see those symptoms, so remember FAST acronym from the beginning. If you see any of those symptoms, like get help immediately. Even if it's not, better be safe than sorry.
Thank you so much for sharing that FAST thing, by the way. Oh, sorry, were you gonna say something?
No, I was gonna add that like another thing that I saw when I was volunteering, and just anytime like that someone is in the hospital or something like that, support systems. You can see that people improve so much better with support systems.
Absolutely. That's also another really important takeaway. And by the way, this isn't something that, is just Liran saying anecdotally that like, oh, she whatever. I mean, like some things, yes, but like the research that she's talking about has been extremely validated and well-researched. It's not something that even came out last year. It's been around for literally decades. In the Canadian Stroke Best Practice Guidelines, which is basically this like guidebook on how to like reduce incidences of stroke within the population, it says everything that she's just said. Anyways, that's it for this episode. Thank you everyone for listening. Until next time.
Adios.
How do I stop the recording?